You're plugged into Schaumburg Speaks, a podcast highlighting and celebrating local businesses and community in the Schaumburg area.
Welcome to another episode of Schaumburg Speaks, where we highlight the people and organizations making a real impact in our community. I'm your host, Andrea Biwer, president of the Schaumburg Business Association, and today we're talking about something that truly touches every business, every family, and every one of us, and that's mental health. I'm really excited to be joined by the team from Ascension Alexian Brothers Behavioral Health Hospital. Joining me today are Brianna, Hewitt, and Lauren. How do I pronounce your last name, Lauren?
Dineen-Griffin.
Dineen-Griffin. So thank you so much for being here today, and welcome to Schaumburg Speaks.
Thanks
How you doing?
Us. We're good.
Well, before we jump in, why don't each of you give us a little background on how you got into the mental health industry? Brianna.
Sure. So, and you can call me Bree too.
Okay,
so,
Bree.
I'm a licensed clinical social worker, and I've professionally grown up really at Alexian Brothers. It's been awesome. I was an intern in the adolescent partial program, and now then shifting gears into coordinating the school anxiety program, and then also the supervisor of the child and adolescent service line. So I'm working with teens all day, every day, and their families, and absolutely love it. We're working with kiddos that are at a really low point, and it's awesome to be able to help them.
To be able to help them. That is incredible. And Lauren, tell us a little bit about your background.
So I'm also a licensed clinical social worker, just as Bree. Same thing. I was also a student intern at Ascension Alexian Brothers. My career has been there. I've been able to have wonderful mentors that have kind of shaped me. I kind of live in the anxiety OCD world. That's my specialty. That's kind of what I've been trained in. And then similar to Bree, I've kind of moved into a supervisor role. I like to say that our role is kind of three different parts. We do like direct therapy, right? We're giving care to individuals. We're sitting down with families, providing interventions. Then we do a lot of supervision training new staff who are new in their careers, students who are in their, masters, their kind of clinical internship. And then we just try to make the program run as smoothly as it can. We coordinate with other professionals. We try to just help patients and families navigate kind of, the healthcare system, which can be really tough, especially the first time coming in and needing help. So just trying to make sure that our treatments run in as best as we can, taking care of our staff, taking care of our patients.
Oh, that's incredible, and definitely important fields. So, Bree, what drew you into wanting to work with children and adolescents? Because that is probably so tough.
Yeah, so I think in general, like the root of me getting into the mental health field, I think a lot of us get in the field or healthcare in general because it touches everybody. And I've always been interested and fascinated at how physical health and mental health are correlated. If one is hindered, the other one typically is too. And so I've seen what really great care looks like and having access to that. And I've also seen that there can be a lot of barriers to access to care. And so at the root of it, I really have wanted to be able to be a part of providing excellent care and breaking down barriers. We're a nonprofit hospital then too. And so getting to help families that have private insurance, but also that might not have access to needs is just phenomenal. And then teens, they're at such a pivotal developmental stage.
Especially now. It's crazy.
Oh my goodness, it's tough. And I think now with social media and tech, which we'll probably go into a little bit too as we're going on, but they have access to so much information, but they don't know how to regulate, and they're trying to find themselves and find their self-confidence, and it's tough. And so being able to be a part of their journey and helping them regulate their emotions, have what I call life skills to help them navigate, and then their families. It's hard to raise a teen, and sometimes they just need some guidance in that process. So all of that combined really is the passion that I have, and being able to walk alongside them and help them grow and thrive.
That's amazing what you do. What about you? What drew you into the older side of mental health?
I get to see a lot of clients ages, 12 through the lifespan. So all different ages and all different, unique personalities and populations. I think it's just such an important thing just as a therapist to be able to see patients come in struggling. Maybe they've been suffering for years without even having someone recognize it, right? OCD can go undiagnosed for up to 8 years, which is just way too long.
Is that something that could start later that you may not have when you're an adolescent and turn into that? Just curious.
I've had adults that have said, like, looking back, I may have seen a lot of these symptoms when I was younger, but just
didn't know.
Never said anything. I didn't know. And now that I'm an adult and I know what this is and how that it can be treated, right? It's kind of like this, oh man, why I could have gotten treatment a long time ago, and probably, it just is something that sometimes people just silently suffer with, right? And so I think being able to really see somebody come in and like really grow and get towards their goals, I think it's a really, I'm so grateful to be able to be a part of that journey, right? To be able to, as Bree said, walk alongside them to say, I can work with a client who hasn't driven a car in years, right? And at the end of treatment, we're driving, right? We're on the highways. We're really working towards that, and it's it's just kind of really just being able to support them along that journey for them. Yeah.
So I have a definite question. A lot of our listeners and business owners, managers, they want to support their team, but sometimes they don't know what to say or do when they could tell some of their employees are struggling. From your perspective, what's one piece of advice you could give somebody that is, has people working for them that they could help them through if they see a team member is struggling? And then we could turn around if they're struggling with, something that's going on with their children. But let's start with you.
Of course, it's kind of counterintuitive, but I think the advice is almost like it's okay to not have the perfect thing to say, and I think we're not going to know the right thing to say until we open up that conversation, right? I think going into that conversation might look like having that curiosity, right? How can I meet you where you're at? And even acknowledging that,
that they're struggling.
Yeah, that they're struggling, and that it may not be the perfect conversation, but there's so much power, I think, as a human in just feeling seen and feeling heard, right? So even starting that conversation with, hey, I don't know the perfect way to bring this up, but I care about you, right? I value our friendship. I value our working relationship. And I've noticed that maybe you haven't been yourself, and I just want to be here, right? I want to be here for you. I want to ask if you need anything, how I can support you, right? That almost those questions can be way more impactful than feeling like you need to have the answer for them.
And is it appropriate if they say they are struggling to give them resources and what the community could do for them? Or is that something that they should should it come from within? Just curious.
Yeah, I think that's a good question. I think if they're in a place where they're like, hey, I might need more help, right? To say, and can I offer some resources, right? Can we look at those together? Is there a way that we can make a phone call together? Do you need that, right? And some people might not just be in that place just yet, right? And it might be, I'm here when you do, right? I'm here when you do need me.
So I have one more question as a follow-up before I go to some more questions regarding the adolescents. What are some of the signs that, as an employer, that we could see that someone is struggling?
Yeah, I would say that there's a couple ways that kind of symptoms can start to kind of creep up in someone's life. I think different areas. I think just our activities of, we call them daily living, right? So sleep, appetite, right? If someone's like noticing I'm not sleeping very well, right? It might be
Isn't that everybody right now?
Right.
Though?
That's very true, right?
Even as a manager,
yes,
we all struggle through the same symptoms. But go ahead.
Yeah. And so I think it's how is that then maybe interfering with their ability to do their tasks, their goals, right? Is it becoming a barrier that's feeling like, hey, week after week I'm kind of
they're maybe not getting some of their work done when they normally have.
Right. I see clients that'll say, like, I am trying to do my work so badly, and my thoughts are just really sweeping me up, and I'm struggling because I feel like I'm multitasking all day, right? I'm trying to address maybe some of these thoughts, these worries that are coming in, and now what may have taken me an hour before maybe is taking me 3 hours, right? We're starting to notice that this is getting more impactful on our day. That would be things to look for.
Okay, that's great. So you're working with teens and children all the time. What are you seeing right now? What are the biggest challenges that you're seeing? Of course, social media, but I have 3 teenagers, or 2 teenagers, 1 adult, but every day is a new day.
Yes. I think there's some interconnected pieces. One, I think not only kids, but also adults, where we have access to so much information with media. So if I'm turning on the news as an adult, I'm overstimulated. And so I think parents and families are exhausted. There's a lot of things going on, finances, job loss, just navigating the household, keeping everything together. It's a lot. And then if family members are having a hard time navigating as adults, okay, well, our kids are seeing that then too. So I think it's a really big reminder of, even in the workplace or as a parent, caregiver, how are we regulating and modeling for our kids is huge. And then our adolescents, like I said, are developing in a way. Their prefrontal cortex is not fully developed, so that's the part of the brain that's helping with problem solving and decision making and just rationality. They're really working from the amygdala, which is going to be that more emotionally ridden response. And then not only that, then they are more sensitive to pleasure, and so dopamine. And so if we're on social media, it's a quick little relief. Yes, exactly. And so I think when family members are tired, and they might have a harder time than seeing their child in distress. And so Lauren and I see this both in, even with adults as well, that sometimes family members want to relieve their child's distress so quickly. And that's okay from time to time.
So they give them the phone, or they let them do some of the things that they probably don't need.
Yeah, and that's fine every once in a while.
Yeah.
But if we're getting in the way of actually having them sit with their discomfort, we're hindering their ability for distress tolerance. And then again, going back to those life skills, we want them to, okay, I'm bored, or I mess up on my homework assignment, or I had an interpersonal issue. I'm not going to just avoid with something that's quick fix. And that avoidance really is going to result in long-term issues. And so I would say, in short, that sometimes I'm seeing that family members are overprotecting sometimes in the real world, and then on the media world, we're underprotecting. There really aren't these guardrails, and then knowing about how the adolescent brain is developing, we need to be mindful in having conversations about what are you having access to, who are you talking to, how much time are you spending on this, and how do you feel after you've spent 3 hours on TikTok scrolling around?
So I have just a specific question regarding that, because I know when we grew up, or when I grew up, we didn't have internet, we didn't have anything at our fingertips. We had to search in our parents' room or whatever, or maybe stay up late and watch a movie and learn things. Now they can learn things that we don't want them to see at 4 or 5 years old. How has that trend, obviously it's been around long enough now for you all to see, how is that affecting people differently, children differently than someone my age that, you could find out, but it was very hard to see all those things?
Yeah, I want to say too, social media and tech is not all bad, all good, but to your
There's
point,
a lot that we don't, as a parent, you don't want your children to see. You don't want to have to address it when they're 6, 7. You want to wait till they're
and they don't know how to, they don't know how to process all of that. So I really think then too, this is getting into okay, what age should they have a phone? How much time should they be spending on it? I do think there needs to be parameters. The recommendation is 2 hours. No one's really doing that for their
who's
kids.
watching their kids, what they're even looking at in the 2 hours?
Yeah.
But even if you monitor them, they're best friends. It's just
tough.
And
so we do see a lot of, there's a decline in mental health for specifically, we see a lot with girls, it's also boys too, but just increased anxiety, worsened depressive symptoms then too. And so I think going back to the point that you mentioned earlier is, we know our family members, we know our coworkers, the people that we're engaging with. When we are starting to notice something's off, it's a great time to start a conversation about it. And I really do believe that parents need and caregivers need to be having some parental controls over it until a certain age where they can be able to regulate and attune to, is this healthy, is this not healthy?
Very important.
Yeah.
So let's bring this back to business, because being Schaumburg Business Association, whether, we all have stress, we all have burnout in our job. I mean, I do, but my team is so great. What are some of the advice that you could give me, even when I'm going through that, that we could do better as employers or as business leaders in the workplace to what advice do you have? I know you all don't have all the magic answers, but just so everybody could take away some nuggets on what we all could do better as a community leader for the people that we interact with.
I think a lot of the times, I don't know what you think, Lauren, but I think that again, with social media and just self-care, that word is thrown out all the time. I think it's a lot of like doing more when I actually think we need to do less. We need to simplify. Like, are we taking our lunch and taking 20, 30 minutes to just pause and not be checking emails? Are we looking at foundational pillars of health? Sleep, right? Okay, if I haven't been sleeping, 6, 7, 8 hours every night, of course I'm not going to be the best version of myself when I'm going to work and navigating all sorts of things in the business world, right? Are we getting movement? Are we getting outside, nourishment,
so encourage
all of it?
Teams maybe to do a group walk during the day or take breaks.
A pause. And just, I think, really looking at the foundational pillars as a starting point. And then I think there's always room to add, okay, do we have moments during the day where we can check out a little bit to help us stay in tune to our own needs and perform well?
Okay. What would you suggest, Lauren?
I echo that so much. I think, just agreed, like self-care, you have to do this and this and this to practice self-care. And I think some of it, is that idea of pausing and actually seeing what we need, right? So how do we actually tend to what's coming up for us versus trying to just kind of do something because we saw a TikTok video that said we should do it, right? And if that is like, hey, I don't
helps.
have, right, if I don't have 20 minutes to myself because I'm a parent and I'm a business owner and I'm running around all day, take that face mask, close your door for 20 minutes and do not have anybody bother you if that's what you need, right? So I think it's being intentional and maybe with your team asking, right, how are we feeling? What do we feel like we need, right? What would be helpful kind of in this phase for us, right? Whether that is like, whether we just have a lunch together, whether it is we have a walk together. I think that having an intentional kind of piece of what we're caring for, right? And who we're caring for, I think can be really helpful.
A good takeaway, at least that I'm taking from this conversation, is I know sometimes it gets so busy. We have 900 companies that we're constantly trying to please and take care of. And I know I have a few employees that like their 30 minutes and they shut their door. And in the beginning when I started, I always used to go like this, hey, could I, so I'm hearing what you're saying and I will let them have that time for sure. Yeah, so that's great. So if someone's listening today and they're struggling, where can you direct them? And especially locally. I know with Ascension, you are in the northwest suburbs and we're the Schaumburg Business Association. Who could they contact? How could we direct them right away?
Yeah, I would say, one, just don't suffer in silence. I think, if you're checking in with yourself, if we're checking in with our colleagues, our family members, is if something's feeling off, just like we go to a routine, primary care physician once a year for our annual visit, the dentist, we should be doing that with our mental health as well. And so, one, our call center is a great place to start if you have any questions. Our hospital is open 24/7 for free community assessments, and that can be a referral source then for just outpatient therapy, psychiatry. If someone's really struggling or it's impairing their day-to-day function based on what Lauren was stating, then we also have our outpatient programs, inpatient facilities as well, and a bunch of additional referrals. And of course can contact Lauren and I then too.
Yeah, always.
That's great. Anything else you want to add, Lauren?
No, this was wonderful to sit down and chat. So thanks for having us.
Yeah, I know this is a short conversation, but so insightful. And for those business people that are trying to connect, obviously look up Ascension Behavioral Health Hospital or anywhere in Ascension in this area. But you can go to schaumburgbusiness.com, and we do have contacts at our website that could help direct you as well. So thank you, ladies. This has been very eye-opening, and I can't wait to take back some of these best practices to my team and my family. So thank you.
Thank you.
Thank you so much.
Thank you.